That's the heart working hard. That's the lungs at a hard workout. The deafening silence that you just heard was the voice of the Hepato Pancreato Biliary system, the most hard-working of all. So resilient, it continues to work until it's severely damaged. The liver, pancreas, gallbladder and biliary tract are interconnected and difficult to manage, quite like our modern metros. The system is also highly volatile, as every minute, 1/3 of all blood in the body is passing through the liver and pancreas. Put together, it qualifies for a potential disaster zone should a problem arise. Surgery is often the best possible solution, which could be as tricky as going into a minefield. It is a task best left to skilled specialists with state-of-the-art equipment which helps them navigate through treacherous ground. There is virtually no scope for error. At MIOT International, it is this combination of expertise and technology that allows us to offer our patients safe surgical solutions with outcomes comparable to the best in the world. These solutions, which could be surgeries or transplants, are performed in our dedicated infection-free twin theatres. They have some of the world's latest operating theatre technologies to control, manage and regulate blood flow, so crucial to success in HPB surgeries. Patients lose approximately 1 to 2 liters of blood in as many minutes from the time an incision is made. Replacing such a large outflow of blood is not feasible. The cell salvage device collects the blood that flows out. It is then infused at the same temperature back into the patient with a rapid infuser system. The nature of the tissue makes closure of blood vessels in the liver complicated. The herb cauterizer and the harmonic scalpel cauterize and seal off vessels efficiently. During surgery, uncontrolled blood flow hinders the surgeon's view and access. The CUSA helps them identify major blood vessels, which can then be separated and taken out of the way. Disease affects the liver's clotting function, which could result in silent internal bleeding. We use the ROTEM during and after surgery to analyze blood samples and pinpoint defects, allowing our surgeons to respond in time. Sometimes regular scans and MRIs do not reveal the entire disease. During surgery, the highly sensitive intra-op ultrasound identifies tiny or hidden lesions and segregates tumors. The HPB surgical team is aided by the cutting-edge blood bank on campus, which provides leukodepleted blood and blood components on par with global standards whenever required. In complex HPB surgery, no amount of technology can replace the surgeon's skill and experience. It's what makes all the difference at critical moments. Our highly skilled team of surgeons with dedicated anesthetists and nurses work tirelessly in perfect sync on surgeries that last as long as 12 to 14 hours. Constant training in this fast-evolving specialty enables them to incorporate the latest techniques. Keeping HPB patients infection-free at all stages is the other critical factor for good outcomes. At MIOT, we take pride in ensuring that the efforts of our dedicated surgeons are not undone by this silent predator. During a transplant, the donor liver is transferred to the recipient through a special corridor within the suite that links the 2 HEPA-filtered theatres. This rules out the slightest contact with the outside world until the patient is wheeled out. Infection control is once again a priority when patients are transferred through exclusive corridors to dedicated HEPA-filtered ICU rooms just 20 feet away. Here they are monitored around the clock by an expert team who works proactively with them until the donor liver fits naturally into its new home. Today, The MIOT Hepato-Pancreato-Biliary Centre of Surgery and Transplantation is one of the very few centres which offer the specialist care required by the most complex organ system in the human body. We will continue to push the boundaries, driven by the spirit of patient care that inspires all of us at MIOT International.